Thank you. Could we hear from Chris Riley?
Thank you, Chairman Keeble, members of the committee. I know the hour is late, and I'll attempt to be brief. My name is Chris Riley, and I'm here on behalf of the Thomas C. Slater Compassion Center. The Slater Center opened in 2013. It served as Rhode Island's first state-licensed medical cannabis facility. It provides a wide variety of products to licensed qualified patients in the state that are affordable and safe. The center is committed to making medicine accessible and provides tens of thousands of dollars each month in free and reduced price medicine for qualifying patients. It has also invested millions of dollars in its facilities, technology, and people to offer products that are meeting patient need. The center cares for patients as young as 3 years old and works in concert with local physicians, including a number of pediatric neurologists who take care of kids who have seizures and seizure disorders or suffer from epilepsy. All the products that we provide are tested using in-house HPLC technology, along with rigorous protocols for quality assurance and quality control without the use of any harmful pesticides. We're here tonight in opposition to House Bill 5865 for a number of reasons. The primary point of opposition involves a lack of data to justify doubling the number of compassion centers. Last year, Rhode Island embarked on a sea change. It changed the structure of its medical cannabis program to create a new licensed cultivator. And those cultivators haven't even really come online to full effect. I believe there's a small number that are out there that are available, and we haven't seen the effect of what that new wholesale market will mean. I think it's important to at least give some time to let that market develop and see how that can impact things like accessibility, affordability, and different quality or strains that can be available to patients. Making another radical change to this program by doubling the number of compassion centers is just going to add further stability to the existing operators. I think it's important for everyone to recognize that the medical cannabis program has a very finite audience, roughly 17,000 licensed patients. Those patients have an array of options in which they can receive their medicine. That includes a generous home grow provision. It includes designating a caregiver or even using a caregiver to go to an illicit source. Compassion centers are one piece of a wide distribution puzzle, and this bill would place added stress on the operation of those existing centers in the absence of any data to demonstrate that capacity is not already in place to meet patient need. I'm here to tell you that our center, and I'm certain the other centers will tell you, we have the capacity to meet not only the existing demand, but future demand. But our real issue is this bill doesn't take into account for what the real challenge in the marketplace is, and that's the black and the gray market that is completely in place and is actually quite successful. And if you look no further than social media, whether it be Craigslist or Instagram, you can see that there's a very significant black market that we compete with every day. And that's unregulated, and this bill does nothing to curtail that. So the idea of simply adding or doubling the number of licenses is only going to add stress to the existing operators if you don't, in fact, take care of the real problem that exists in the black and the gray market. Right now, there is a legislative study commission that's looking at this very issue, including, whether or not there should be additional compassion centers added to the program. We trust that this group will study the data. We hearken to the words of our chief regulator from the Department of Business Regulation, who said that this program has never had any real data as to what the patient demand is and what the production is in this program. We're doing that now. At the DBR, they have plant tags where they're able to quantify how many plants are grown in the regulated market. They're also implementing an electronic inventory control and tracking system so you can see that the purchasing of patients so you get a better idea of what the actual demand is. This bill would double the number of centers without taking into account any of the data that's currently being collected. All we ask is you made a tremendous change to the program last year, creating a wholesale market. Now you're looking to put further stress on the existing operations. Let's at least take a look at the data that the DBR is currently collecting, that the study commission is looking at before we make this decision. There was a question that came up earlier about what other states do, and I would just tell you that Rhode Island is in no way an outlier with regard to the number of centers that it has in statute. Now, there are states that have a deregulated model that allow for unlimited or a wide number of licenses in this arena, but I'll rattle off some to give you an idea of what some other states are doing. D.C., with a population of 700,000 people, has 5 facilities. Maine, 1.4 million people, 8 facilities. Hawaii, 5 facilities for 1.5 million people. Delaware, 3 for 900,000 people. New Hampshire, 4 for 1.4 million people. Minnesota, 8 for 5.5 million people. New York, 20 dispensaries for 20 million people. New Jersey, with roughly 9 million people, has 6 dispensaries. And our neighbor to the north in Massachusetts has just 10 dispensaries that are open right now. I would say there's no way we can say that Rhode Island is an outlier in the structure that it has with the 3 compassion centers that are in statute. All we're asking for, this is a worthy discussion. Let's at least look at the data that exists before we go and add further stress to the existing operations. There are those that are advocating for this bill because they see it as a business opportunity, either in a medical or recreational market, which is certainly their prerogative. However, the state could harm the existing operations like ours immeasurably if the number of licenses doubled, and the abuses in home grow and the burgeoning gray and black market are not addressed. The issue of price has also come up. I'm very proud to tell you that our facility, and I'm sure the other facilities in the state can attest to this, our prices that we offer at our center are better than what you'll see on the street. And we know this because we're pretty attuned to what the street is, but there's actually indices that report what people pay for cannabis from illicit sources. And I looked at one of the indices that people regularly look at, where they had 1,700 transactions that were provided to the index, and the average price in the Rhode Island market is anywhere between $253 and $310 for an ounce of cannabis. I'm proud to report that our center has daily prices that average out to $220 or less for high-quality medicine, and we look forward to making additional investments into our operation to bring that price down even lower. There are 2 other additional problems that we have with this bill. It calls for a geographic distribution of the new centers, but it does not include Kent County in the legislation. We don't know why that's left off. That seems to be terribly unfair to the existing operations in Providence County and Bristol County. And then the other issue is obviously with the potential for recreational sales in Massachusetts. That could have tremendous impact and harm on the existing compassion centers, and just adding an additional layer of new compassion centers, which this bill does, with Massachusetts doing what they're going to do, could really stress the operations of the compassion centers, and we think that needs to be taken into account, and we certainly hope that Representative Slater's bill could be a panacea to that. So in sum, we certainly think it's worthy of discussion with regard to the expansion of the centers. We just ask that the decisions made with regard to that are done with data, and we're actually getting data right now from the Department of Business Regulation. Let's use that to make an informed decision rather than to just double the size of the existing compassion center footprint, making that decision in a vacuum. And with that, I'd be happy to answer any questions.
Mr. Riley, if that was your brief testimony, I'd hate to have to sit through your full testimony.
Apologize.
Representative Filippi.
Thank you, Mr. Chairman, and thank you, Mr. Riley. I've done a lot of research, and I was amazed at the amount of money that Big Pharma spent to try and stop the legalization of cannabis for medical purposes. You know, some reports out there over $880 million over a 10-year period. And I felt that that's because they didn't want competition from something that was an alternative to their drug. And I believe in that argument. So I must tell you, I'm amazed to have a marijuana dispensary coming here and asking us to prevent more competition with what you essentially have 1/3 of a monopoly on right now.
I'm not sure that's what I'm asking you for.
You're saying don't allow additional compassion centers because the demand isn't there.
Well, I'm telling you that our facility, and I think you're going to hear from the others, we have excess capacity that we can meet not only the demand that we have now, but even more demand. But what I'm asking for is different than that.
What do you say to one of my constituents in Westerly who has to drive 35, 40 minutes up to the nearest compassion center in Warwick? Should I say that the 3 existing compassion centers, feel that they supply the market enough, and you should have to drive because they don't think that there is enough demand for the capacity that's out there?
I would tell them that there are options, as I indicated in the testimony, This program has a pretty vibrant opportunity for patients to either grow their own, to utilize a caregiver to access medicine. The dispensaries are heavily regulated right now through the DBR. And there's a provision that allows for home delivery service, which is actually in the regulations that just came out. And we look forward to, and I'm sure the other senators can speak to this, having a home delivery option. But to get back to my point, Representative Filippi, I'm not saying that you should totally discount the theory that, or the argument that there should be more centers. I'm just saying we need to make that decision with data to see what the actual market demand is. And the other thing I would add is this.
Does the market determine that? Here we are trying to figure out how the market works.
Right.
Wouldn't the market squeeze out those that can't make a profit and
think
allow those that can make a profit to continue on in business?
The only difference, this is a very unique set of circumstances that we deal with. You can only transact with licensed qualified patients. So you have a very definite number of people that you can deal with. This isn't like there was an example about if we only had CVSs in the state, there would be pitchforks outside the state's house if we just limited people to go there. Because you can only deal with those people that are defined in the state and qualify as patients, and you have this black and gray market that is thriving that people can go to. If you're not going to address that black and gray market, all you're doing is adding excess capacity to the regulated market that we have, which could challenge our ability to make investments and offer even better services to our patients. It's akin, let's say we decided we wanted to have more hospitals in the state, and we didn't take into account whether or not there was a patient demand for that or a need for that. We just said, hey, let's have more hospitals because if there's more, it'll be better quality services and the price will go down. I don't think you can account for that, especially in this environment where you have a black and gray market, which is a force that no one can control, and that's really what's driving this. If this bill said, let's eliminate or do things that can really hamper the ability of that black or gray market, then this discussion has lots of merit. This does nothing to do that. All it does is put stress on the existing operations. We've invested millions of dollars in this operation based on a regulatory scheme that we have, and also based on a geographic distribution. When this program was put in place and the selection of the facilities was made by Dr. Fine going back to, I believe, 2010, it was a geographic distribution. So if there's an issue in Washington County, then maybe that's an argument that we should have based on the data if there's a demand for it. But this bill doesn't do that. It says we're just going to double the number of centers, and it could be anywhere. So for us, we want to at least go on the record to say that's a concern. Let's use data and let's make an informed decision. And if there is a need in that county and we're seeing that it's not met, then that's fine. But let's look at the data. That's what we're asking.
What kind of market data was utilized to determine that 3 was the appropriate number?
You know, that was a decision that was made by the General Assembly back in 2009. And there may have been a number of reasons for that. I can't speak to it, but I rattled off a number of states who have similar regulatory structures to ours that are working quite well. So, I mean, it's all over the map. You see some that have a lot, some that have a limited licensure. I don't think there's any rhyme or reason to it. Again, all I'm saying is let's take a look at the data. Let's look at what the demand is based on what the DBR is able to track. Let's look at what the cultivation is. We have plant tags now where we can tell how much cannabis is out there that's being grown and shifted around this marketplace. Then we can make an informed decision.
Let me ask you a question. Is it your contention that if you are able to keep up with the demand, or the 3 compassion centers are able to ramp up production, or the wholesale suppliers are able to ramp up production and keep up with the demand for the entire state, is it your position that we should always limit the number of licenses to 3 because the 3 existing companies can supply the demand that's out there?
My position is we should make informed decisions based on data, not just a piece of legislation. I don't know what data exists that shows that we should double the number of compassion centers, other than some anecdotal evidence of people who may come up here that have an issue with regard to accessibility or have a concern with what.
I think accessibility is a real issue.
I mean,
there's a reason why Dr. Fine chose Kent. Was it Newport County and Providence County?
It was Bristol County, Providence, and Kent.
And Bristol was intended to serve the East Bay.
Right.
Warwick was intended to serve Central Rhode Island. Providence was Northern Rhode Island. And Washington County got left out of the mix.
Right.
So I think there is a public need at this point to have additional licenses because the people who I represent don't live close.
Well, this bill
far
doesn't.
away. And maybe the old lady who's sick who I represent doesn't want to start a grow house. Maybe she doesn't know anyone who could be a caregiver. She just wants to drive and get her medicine.
Right. And I think it's a
And
great
she's got to
point.
drive 35 to 40 minutes to Warwick. And the reason that you're arguing that shouldn't be is because you guys don't want market forces and market competition.
No, it's not. What I'm saying is,
Excuse me. I think that this has gone from question and answer into a discussion between the two of you. And
I mean, that's the point of the hearing, is to flesh out these issues, Representative Joe. And this is a real issue. Excuse me. This is a real issue for the people in Washington County.
Representative Filippi, I am chairing the meeting right now. I would ask, you have one more question for Mr. Riley. And please make it a question.
I'd be happy to have the discussion, but to your point,
I have one more question. Did you enjoy testifying up here tonight? Because I actually really did enjoy this conversation, and I thank you for coming in.
no, I appreciate it. With regard to Washington County, this bill doesn't guarantee that you'd see a facility in Washington County. And again, if the data suggests...
Thank you, Mr. Riley.
Thank
I think you've made that point.
you.
And thank you, Madam Chairman, for your leave.
Representative Vella-Wilkinson.
Thank you, Madam Chairman. Just a couple of quick questions. So it was testified earlier this evening that the increase in the clients has been going up by 3,000. Could you just walk us through what the increase has been at your particular compassion center?
Right. Well, I can tell you what the picture is right now.
Okay.
So our facility, if there are roughly 17,000 patients that are licensed in the program, within the last 3 months, at some point, whether it be one visit or a regular visit, we see about half of those patients. So they might come in once, some might come in once a month, some might come in more regularly. Right now, there's no restriction on which centers you can go to. Before, you had to designate a facility for your care. That's no longer a regulation or a rule. So people have the freedom to go to different centers, and they do that. So, but within the last 3 months, Representative, we've seen roughly about half the patients in the state, a little under half, that have at least tried to come to our facility.
What would this committee need to do, or who would we have to speak to in order to get our arms around where the clients, not their actual addresses, but the municipalities that they live in? Because I will tell you that, as I had testified earlier, I had gone to the Department of Health testimonies, the public hearings, and there were several mayors who said that they did not want either a compassion center or a growing center in their municipality. So I'm just curious, is there an agency, whether it's DBR or DOH or the compassion centers themselves, that could let the members of this committee know that out of so many clients that they have, this number is in each of whatever the municipalities are, so we have a better way of identifying what the clientele looks like, at least for those individuals that are accessing medical marijuana?
Representative, the data is there through the Department of Health, and the DBR, I'm sure, could provide it. I'm not here to speak for the regulators here. But that data exists, and through whether it be the Oversight Commission or testimony provided in a forum like this, you could find out what the patient breakdown is, and through the data that's being collected on the cultivation that's taking place, you get an idea of what production, and you can make an informed decision. There may very well be a very good reason to have a Washington County dispensary. I would just like to see that decision made with some data taken into account. That's all.
No, I get it. Thank you very much for your testimony tonight.